Hi, everyone. Thank you for joining me today. My name is Nicole Ann Needles. I am a physical therapist. I work at AI DuPont Hospital for Children with Nemours Children's Health System, and I am also affiliated with the American Physical Therapy Academy of Aquatic Physical Therapy. Today's topic that I will be sharing with you are the benefits of physical therapy for children with JIA. So I think first what would be helpful is to know a little bit about what is a physical therapist. So a physical therapist is considered a movement expert. They are someone who can address movement, joint, and pain limitations or deficits. Some of those deficits may include muscle weaknesses, soft tissue or decreased flexibility, decreased endurance, or decreased balance. Physical therapists are part of a team that help to promote healthy habits and healthy lifestyles. They educate you on safe movement patterns as well as joint protective strategies. More specifically, a pediatric physical therapist is someone who works with children from birth to about age 21 years old. An aquatic physical therapist is a physical therapist who treats in a therapeutic pool. I do both of those things. So let's say your child has just been diagnosed with JIA and you get a referral to physical therapy. What can you expect at that initial evaluation? So first off, plan to be there for about 45 to 60 minutes. And I suggest you dress in comfortable clothes that are easy to move around in. During that session, the physical therapist will ask you a bunch of questions to just get to know you and your child, and are there any specific goals you hope to work on? They will also assess your child's posture, and this can be done in standing, in sitting, or lying down. They will assess your child's strength, and depending on the age, that may vary in how that looks like. They will assess your child's range of motion. So how much movement do you have at a joint? And depending on why you're there, it may be a shoulder joint, it may be a hip, it may be a knee. And we'll focus on all of those as is appropriate. We will also watch your child walk. Fancy term is ambulation. And then other things that we may look at are functional activities to assess functional strength, such as stair climbing, squatting, or other activities. Hopefully by the end of your session, you will be provided a HEP or a home exercise program. And I will give you some examples of what that may look like in a little bit. And before you leave that session, you will have your plan of care. So based on this evaluation, what is that therapist recommending for your child? A common plan of care could be one time a week for 6 to 8 weeks. And we call this episodic care. So basically you can come in, you would be seen for about 2 months, and then you would take a 3-month break or some version of that time. And then you'll come back to us and we will assess and see if there are any new deficits or limitations that we can be working on. Again, this will vary depending on your child's age, as well as the areas of deficit. I want to briefly talk about some session details for if your child is of a school age or younger. So one of the questions you may have is, should I stay and be present for that session? So this isn't the evaluation, this is when you've come back in for your session. Yes, absolutely. We would love you to stay and be present. However, there is an exception to this rule. If your child is someone who does better with you maybe just not in their line of vision, then we could recommend you standing either outside the door or in an observation room that's right nearby. Some home exercise program examples for this age group can include animal walking, such as walking like a penguin, hopping like a frog, or crab walking. Crab walking is the most difficult of any of these. I normally recommend that you can try and make this as part of your routine at home. So I tend to suggest to families, maybe it's something you do every morning when you leave your child's bedroom. In the morning, before they go to brush their teeth, and they have to walk like this animal down the hallway from their bedroom to the bathroom and then maybe back again. And it's something the whole family can do. And you can also do this again at nighttime. Another example of a home exercise program for this age group could be yoga poses, and these would focus on balance and stability. This can include a tree pose or a warrior pose, to just name two. For your preteen, should I stay present? That's a great question. Typically, we say at the beginning, it helps if you can remain present just to get the initial information. However, then over, let's say, sessions 2, 3, and 4, you may be comfortable enough and your child may be comfortable enough with us that you don't need to be right in that immediate area. You could remain in the waiting room. But it is important for you to be there at the beginning of the session to give us any subjective updates on what's going on since last time we saw you, any new concerns, or any new progress too. And then at the end of the session, so you can kind of get that wrap up of information. What did we work on that day? And is there any new home exercise program ideas to be working on before the next session? For this age group, some typical exercises we provide are bridges, single knee to chest, or double knee to chest. These are both simple, gentle stretches for the lower body and low back. And I will demonstrate these in a little bit. For your teenager, should the parent or caregiver remain present? Typically, we don't have you guys remain present for the session, again, except for that beginning and the end. However, there are also exceptions to this rule. If your child feels more comfortable and wants you nearby, then you are absolutely welcome to stay. In this age group, typical home exercise programs can include ankle circles or ankle pumps. They're exactly like they sound like. Shoulder rolls, something I can demonstrate right now and we'll demonstrate in a little bit as well. It's just bringing your shoulders up, back, and around. It's a nice stretch to those shoulders. We recommend doing at least 10 of them in a row, nice and slow. You can go backwards as well as forwards. Hip strengthening exercises can also be done in various positions, whether that be in standing, lying down, or on your belly. And I will demonstrate a little bit of those in a little bit. It was suggested that before I finish this whole video, that I provide you with 10 tips or takeaways that will be helpful to you. So this page just has a quick overview of what those 10 tips or takeaways will look like. We're going to dive into them a little bit more as we go forward. Please know that all exercise recommendations are truly best performed under the supervision of an expert. Tip 1, physical therapy and working with your child, it's a team approach. We are a part of your team, and it's important to know that we're on your side. From a big picture, as I've mentioned earlier, we're hoping to promote positive, healthy lifestyle choices, and it helps if you can make these part of your day-to-day routine. So it's suggested for your child's benefit that they do daily stretching in the morning and night. It will help them feel really good. And then alternating days of doing cardio-based activities and then strengthening activities. So this can be done, let's say, Monday, Wednesday, Friday, and then Tuesday, Thursday, giving yourself the weekend to have a little recovery. Some other members of your team may be your rheumatologist, your primary care physician, PT, as I've already mentioned, like myself, or an OT, an occupational therapist. Where I work, they tend to focus a little bit more on that upper body, shoulders, elbows, and wrists more specifically. So you can always ask for additional information at that time. Other specialists that may be on your team can include a weight management specialist or a nutritionist. They will just offer a unique aspect to your care if needed. Tip 2, consider exercising in the morning to reduce joint stiffness. So as a parent, what you can do is encourage your child before they get out of bed to move. As they sit up and they're sitting on the edge of the bed, move. As they take their first steps, move. It's all about movement. Movement will really help you feel better. For further joint-specific examples, you're going to refer to tips 4 through 7. Tip number 3. Some exercises can actually be done while your child is seated in school. Again, this may not be for your younger school age child that's in, let's say, kindergarten, but for your older children, this may be something that they can work on simply while they're seated at their desk. Let's say they have morning neck stiffness. So what's one way that they can gently work on stretching their neck? They can gently stretch their neck to the side and hold it there for a few seconds, and then repeat again on the other side. Just gently getting some motion and some stretch to the muscles there. Another option would be to rotate and turn your head so you're looking over your left shoulder for a few seconds like this, and then your other shoulder. These can be held for 3 to 5 seconds, repeated 5 times, again, just to get some movement in that neck while they're sitting and paying attention at school. Another option would be to do those gentle shoulder rolls, or I put here shoulder circles. So again, I mentioned earlier, you can go backwards or you can go forwards. Just trying to keep those shoulders nice and loose and relaxed. Also important is sitting up straight. Don't forget about your posture, something we all forget. And we're all slouchers, let's be honest. So something I've had children do is set a little alarm on their watch that will just vibrate for them, or on their cell phone. Maybe it's every 30 minutes, maybe it's just once an hour. Maybe it's something they think about every time they change classes in school. So think about sitting up straight, aligning your neck and your shoulders over your hips, having both feet on the floor, and just working on holding that for maybe 30 seconds to a minute before you go back to your slouch posture. Some other easy activities that can be done while seated at school could be seated marches or kicks, which I will demonstrate in a little bit, or ankle pumps. Again, the key to feeling good is to keep loose and keep moving. Some additional neck and shoulder exercises can be what I'm going to talk about next. This can be simply lifting your shoulders up, holding and squeezing, and then lowering them down. And this can be done seated. This can also be done when you're lying in your bed, or maybe even just on your couch at night. And this is really an emphasis on focusing on breathing as you're doing an exercise. So you can inhale, hold, and then when you lower, exhale, and you'll really feel those shoulders and those neck muscles relax. Another exercise could be shoulder blade squeezes. And this again can be done in standing, sitting, or lying down. And I will demonstrate these later. A deltoid stretch is a stretch just for that front of the shoulder and the back of the shoulder. And it's simply just reaching across, holding it for 20 to 30 seconds, and repeating it 2 to 3 times on each side. Tip number 5, when we're thinking about our back, we should be thinking about 2 pieces here. One would be stretching out the back, and the second piece would be engaging our core muscles. So when you're thinking of stretching your back, one simple way to do this is to lie on your back and gently bring both knees towards your chest and give it a hug. You can hold this for 20 to 30 seconds, then relax in between, and then repeat it again 2 to 3 times. You can also do this as a single motion. So a single leg, maybe just the right leg, bring it up, give it a hug, hold it for that 20 to 30 seconds, repeat on the other side 2 to 3 times. It's going to really stretch out that low back. And then child's pose. That's one that a lot of our younger friends probably know. It's a yoga position. And I love this one when you totally relax and just let everything go, and you'll feel a nice relief in your whole body, really. The second piece, as I mentioned, is engaging your core. So your core muscles are the muscles that are not only your abdominals in the front, but also your oblique muscles, which are on your side, and then the muscles in your back that are kind of just adjacent to your spine. So I wanted to talk about one specific exercise here. The fancy term in PT land is called Titanic abdominal contraction, or TACS. So it's something that your child, probably your preteen or teenager, would learn within the first session or 2, maybe even on their home exercise program day 1. And basically what you do is you lie on your back, you have your knees bent, and you're going to make your stomach muscles tight. You're going to act as if you're pulling your belly button towards your spine. You should still be able to breathe when you're doing this exercise. And sometimes I have the children count out loud to just make sure they're still breathing. You can hold this for a count of 1, 2, 3, and then take a break and repeat it 10 times. Tip 6 is knee joint specific exercises. So one example of this could be gently doing squats, or if squats are too challenging at first, you can do sit to stands. And sit to stands is basically a functional way of working the same muscles that you would when you were doing a squat. Sometimes this seems too easy for our kids, so I put some examples of how to make it a little bit more challenging. You can start by changing the speed, moving slowly at first, and then speeding up. Again, this should only be if you can control the motion. Changing the depth is another way to progress this exercise. So maybe not going as deep with your squat at first, or starting when you're doing that sit to stand from a chair that's a little bit higher, and then progressing to a lower surface or going deeper with your squat. And this should be through your pain as tolerated. It doesn't mean you won't have any pain, doesn't mean you'll be pain-free. However, you should listen to your body. Changing the repetitions or the reps, we typically suggest someone start out with 1 set of 10 and progress their way to 3 sets of 10. I say this at the bottom of the slide here, but it is really important that if you're not familiar with these, that you seek out a physical therapist or some other exercise specialist to give you information on how to start these exercises and definitely on how to progress them. Another exercise could just gently be bending and straightening your knee while seated in a chair. Sometimes I just call these seated kicks. And again, just repeating, progression should be at the advice of an expert. And we typically work on it through a couple weeks. It's not just week 1 to week 2, we go from 10 to 20. We look at your child and how they're moving and how they're doing these exercises. And then we progress them based on how we feel they're doing, including how they're probably engaging their muscles and doing the positioning of the exercise correctly, because we want to make sure we're carrying those safe joint positions. I mentioned this again, but I want to mention it again because I think it's important. Your child's not always going to be pain-free. We're not going to take away the pain necessarily. However, moving will make your child feel better. And our mission when we're doing some of these exercises is that we shouldn't increase the pain too much. So if you're not sure, when in doubt, ask a physical therapist. Tip number 7 is specifically for wrist exercises. So a lot of times our children have wrist stiffness. So we can work on stretching the wrist in all 4 directions. So what I mean by that is stretching your wrist up, down, left or right, sometimes in and out. If you're doing a stretch, it should be held for a few seconds. So I have on here the recommendation to hold this each position for 5 to 10 seconds and then repeat it for 3 times. Please note that you can do the stretching with your wrists facing down or your wrists pointing towards the ceiling. You're going to get different stretch to different muscles in each way. Another way to stretch the wrist is just by doing simple wrist circles. It's as simple as it sounds. You're going to go clockwise and then counterclockwise. I tend to suggest doing 10 each direction. And these exercises are ones that you can absolutely do for have your child do whether in school or at home while they're seated. They can be in their bed or any position really, because they're all very safe. Tip number 8, what about aquatics? So I mentioned earlier that I am an aquatic physical therapist, so that I work and treat children in the pool. So sometimes we recommend, or sometimes a physical therapist at that plan of care decides that your child would benefit from land therapy only, or aquatic therapy only, or sometimes we do them together. So it would be considered an adjunct to that land therapy. To have aquatic physical therapy, you still need to have an evaluation, just like I mentioned earlier, that would be completed on land. So you would come, dress in your comfortable clothes, that 45 to 60 minutes, all the assessment determining the plan of care. If the physical therapist says that that plan of care would include aquatic physical therapy, it is suggested that you check that your insurance company will cover this entity. Therapeutic pools tend to run really warm at a therapy temperature. Anywhere between 88 and 92 degrees is typically what you would expect. For additional information on aquatic physical therapy or how to find an aquatic physical therapist in your area, please refer to the following websites. Once there, select Aquatics under Settings. Tip 9, Assistive Devices, when and when not to use them. So what are assistive devices? These can be canes, crutches, or walkers. They're typically used to offer additional balance support. When should you use them? Only at the recommendation of your physician, specialist, or physical therapist. Most of the time, if we recommend them, it's temporary, if at all. And again, more just for that balance support and to take some of the weight or load off the joints that may be bothersome at that time. Tip 10, bracing options. What to use and when. So what are some common braces? A brace could be anything that's going to stabilize a joint. So this could be a wrist splint, a thumb splint, an ankle splint or an ankle ace wrap, or a wrap for any other body part, such as a shoulder, sling, or a boot. So when should we use them? Only at the recommendation of your physician, specialist, or physical therapist. Similar to the assistive devices, mostly we recommend them for temporary use if at all. If your child is in a joint flare-up, there's no reason they couldn't use one of these bracing options for that temporary relief. But I want you to know that it is important that the child keep moving. So for example, if your child has a flare-up at the wrist and you put an ACE wrap on it, they're not going to move it as much. So the joint is going to become stiff. So when they go to move it again, it's going to hurt. So when it hurts, you're going to suggest putting the ACE wrap back on. So it becomes this cycle of pain. And that's one of the areas that physical therapy will work with you on, helping you to know when it's good to have that ACE wrap on, how to gently start moving that joint again, and remembering that movement will help you feel looser and feel better. In conclusion, hopefully you've learned that moving the joints is best. I know as a parent myself, our first instinct is to protect our child from pain. However, with JIA, your child's going to have flare-ups and have occasions of pain. And it's better to encourage them to gently move their joints versus not moving them at all. Please, 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 if your child is in a current plan of care with physical therapy and they're having a really bad flare-up, don't cancel that appointment. It's optimum for you to come in and for us to work with you on that day because it's one of the best times to come in because movement is best. Thank you so much for your time. If you have any additional questions, please feel free to reach out to me at my information below. Thank you so much and take care. So this is how you do ankle pumps. You just move gently up and down. They are easiest when you're seated, but you can also progress doing them in standing. And simply a set of 10 will do. Ankle circles look just like this, doing clockwise and counterclockwise. I typically recommend doing 10 each direction. Seated marches are exactly like they sound. You sit and you march. I would suggest keeping your belly engaged and sitting upright as well while you do this exercise. To do the shoulder stretches, you can perform these in seated. You gently bring one ear towards one shoulder. You don't need to use your hand, but if you are at home versus at school and you want a little bit of an extra stretch, you can gently hold just like this. And then you can repeat simply to the other side, bringing the other ear towards the other shoulder. For the shoulder stretch, to stretch out your deltoids, again, can be performed seated or standing. You're going to bring one arm across the front, gently using your other arm to maximize the stretch to the back and the side of the shoulder where those deltoids are. Typically, we hold this for 20 to 30 seconds. Relax in the middle, and then repeat on the other side. If you are someone who has shoulders that are really loose and pop in and out, this is not the stretch for you. So again, please consult a physical therapist. To stretch your wrists, you can simply stretch upwards, hold for 5 seconds, down, hold for 5 seconds, in, hold for 5 seconds, or out. Again, this can be performed with your palm down or your palm pointed towards the ceiling. Stretching up, down, in, or out. Moving just within your range of motion and ability. To do bridges, you should have a nice space on the floor. I'm just laying on a folded up blanket and I have a pillow to support my head. When you do the bridges, you're going to have your knees gently bent, your feet will be flat on the floor, your body will be flat on the floor, and then you're going to lift your hips up and down. Two things that I look for is that you're going nice and slow when you go up and down, as well as to make sure that your hips are level, that one side is not higher than the other. Watch me as I do it. Make your stomach muscles nice and tight. Pull that belly button down. Gradually lift up. Slowly down. Again, keeping in mind that you don't want one hip to be higher than the other. You want them to stay nice and level. For single knee to chest, you're going to lay on your back. You're going to bring one knee towards your chest and give it a hug. Hold it for a couple seconds, and then relax and repeat on the other side. I will demonstrate this a few times. Switch in the middle. For double kneaded chest, you would just bring both knees toward your stomach and give it a hug and hold, and then relax in between your repetitions. So an example of frog jumping is just like it sounds. You're going to pretend you're a frog and bounce across your room. Squat down, jump up. Squat down, jump up. Squat down, jump up. To do crab walking, you're going to start in a position like this, where you lift your bottom in the air, and then you're going to try and walk your hands and your legs forwards as you keep your bottom off the bottom of the floor. This is really hard to do. You can go forwards or backwards. Sometimes I have children pick up different things and put them on their back to make it part of an activity, such as maybe puzzle pieces. To walk like a penguin, you're going to walk on your heels across the room, like this.